Hi guys, in this video I am covering the topic of ovarian cysts. So most women will develop one of these kinds of cysts in their lifetime, but they won't present with any symptoms, and so usually it'll go by unnoticed until eventually the cyst disappears by itself. But what is the purpose of these cysts? Why do some women get really bad pain with them, and how do they disappear? Let's get straight into it. Your ovaries as reproductive organs respond to an intense and overwhelming feeling of loss. This sadness and grief, if you feel like it's something you cannot overcome, signal for an adaptation response by your ovaries. If you have ovarian cysts, then it is definite that you experienced a loss conflict, but not all losses in our life will cause these cysts to develop. The experience that causes them has to have three components to it. So it needs to be one, shocking. It's something that you cannot prepare for. It catches you completely off guard. Two, it is isolating. So you feel alone in having to deal with the emotional components. And three, it is so overwhelming that at the time you feel like you cannot overcome it, and so you are stuck in that situation for the time being. And so a loss conflict can range from a breakup or divorce from your husband or partner to a sudden disappearance or death of a loved one, like your child, your parent, your partner, a friend, or even a pet. It doesn't get triggered by, say, the loss of a job or a house. It has to be in relation to a person, so it always involves a relationship with someone else. A miscarriage or an unfulfilled desire to have a baby, particularly if you are really trying to conceive or have been for a while, can also initiate this conflict. And with the last example, even the onset of your period every month can trigger a loss conflict in your brain, as it signals another month gone by without a baby. Children can also experience these kinds of conflicts, particularly if it is so overwhelming that they cannot process the situation at the time. So let's take, for example, a child who is walking a dog. She is in charge of holding the leash when all of a sudden the dog pulls a little too hard and she lets go, and the dog subsequently chases a bird across the road where it is hit and killed by a car. In that exact moment in time, that girl processes the experience as a loss without her conscious awareness. She is so shocked and overwhelmed and feels like it was her fault. Her ovaries here will take the impact of the shock. Now, children will not experience any obvious symptoms of an ovarian cyst until the onset of their first period. So if you have always had a particularly heavy or intense period right from the beginning, you may want to explore whether you experience any losses in your childhood that you have not come to terms with or were too overwhelming to process at the time. Another possibility, although it's less common, it can still trigger the same kind of response from your body, is an intense and particularly nasty conflict with a male. So this can be a intense argument or breakup, or say for example a discovery that your partner is cheating on you with your best friend behind your back. So what happens in your body? Upon the initiation of the conflict, one of your ovaries will take the impact of the stress and undergo tissue breakdown. This won't usually be noticed because it's not painful, although you will get a temporary drop in your estrogen levels because the tissue that is lost will no longer be able to produce estrogen. You may also experience the usual stress symptoms like cold hands and feet, high blood pressure, and the inability to sleep well past 3 o'clock in the morning. Once you are able to process the loss, if enough time has passed for you to come to terms with it and let it go, your body is pushed into healing mode. The lost tissue in your ovaries will now be replenished with a fluid-filled cyst. This cyst will grow new ovarian tissue within it, and eventually it will shrink, harden, and be absorbed completely by the ovary. This process takes around 9 months to fully complete, and the purpose of this new tissue is to boost your estrogen levels in your body so that you will appear more attractive and ready to mate to the opposite sex, so that you can now reproduce and replace that loss that you experienced. Now, this may not seem like the done thing or socially acceptable, especially in the example where maybe you lost your husband. You wouldn't want to go running around and making another baby to replace that loss. However, in your body's language, it is only fulfilling a biological function and providing a solution for your problem in the best way that it can do that. Now, things don't always go this smoothly, and sometimes it takes way longer than 9 months for a cyst to heal and disappear, because we often get stuck in cycles if the conflict was not fully resolved, and we get reminders of it here and there. The fear of the experience happening again can also keep it going by itself, and feelings of guilt or secretly blaming ourselves also stops the body from being able to completely heal. The cyst itself can grow really large and cause a lot of pain when this happens, and if there's too much fluid accumulation within the cyst, it can actually burst, and with that comes a whole other host of issues that I will cover in another video. And you can also develop more than one cyst at a time. So basically a whole host of potential issues that can happen with this process if you are not aware of what your body is doing. The first step in healing, as always, is an awareness of the process itself and the conflict that has activated this adaptation response within your body. You will need to do some digging and try and unearth the loss that you experienced that you may not have come to terms with. And to do this, you don't have to go right back in your past and potentially trigger old trauma. What you need to do is figure out the conflict that may be at play and pull it into your present awareness, where you can hold a different perspective on the experience and not be so emotionally attached to it. So making that conscious connection between the experience that you experienced and the changes that are taking place within your body is about half the work actually done. You will then need to work on coming to terms with what happened and letting go of those emotions. It's like closing and healing an old wound that you did not even know was causing you so much pain and discomfort. So I hope this video has been helpful, and if you have any questions, please let me know in the comments, and I will see you in the next video.